Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Once someone gets diagnosed with breast cancer, what does treatment usually look like?
I think firstly, it's critical that one gets treatment at a state-of-the-art cancer center because breast cancer is treated in a multidisciplinary team whereby you have the breast surgeons, you have the medical oncologists and radiation oncologists. And the treatment is usually customized based on, first of all, how advanced the cancer is, and secondly, the type of breast cancer. For the treatment purposes, we generally divide patients in three buckets. One is when they have localized disease, second is when they have locally advanced disease, or third is when they have stage 4 or distant disease. So for localized disease patients, these are the patients where the cancer is still limited to the breast. These are the patients that usually get diagnosed based on screening tests. They have excellent 5-year survival. Their survival is closer to 99%, so therefore they have a very high chance of getting cured. Locally advanced patients would be the ones whereby the cancer has spread to nearby areas such as lymph nodes. These patients have slightly worse prognosis than patients with localized disease. Their 5-year overall survival rate is around 86%. So in general, for patients that have localized or locally advanced disease, surgery is the main treatment modality. Many of these patients would get radiation after the surgery. In addition, many of these patients would get medications. Some of them may require chemotherapy. If somebody has hormone receptor positive disease, they may require hormonal therapy. Nowadays, we have newer treatment modalities such as immunotherapy, targeted agents, so highly selected patients may be eligible to get that. So when we talk about patients that have distant or stage 4 disease, that means that cancer unfortunately has spread to other areas of the body, such as lungs, liver, bones, etc. In a sense, these tumors are not curable. Their 5-year overall survival rate is around 29%. For these patients, they can be treated with medications. The idea behind giving medications is, first of all, to prevent the tumor from progressing, to help relieve any symptoms that the patients may have. And often these therapies will also help prolong the life of the patient. And I think the silver lining is in the last several years, due to extensive research that has been done in the field of breast cancer, FDA has approved a number of new agents, such as immunotherapy, a number of targeted therapies, and breast cancer outcomes have improved incrementally with the addition of each of these new treatment modalities.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.